Ladies and gentlemen, before starting my order communication, I would like to introduce myself. So my name is Dr. Aissa Sofiene, and I'm a psychiatry resident working now at Razi Hospital in Tunisia. And today I'm going to present to you my oral presentation entitled Breaking the Silence in Revealing Mental Health Stigma Among Tunisians Youth. So the plan of my study, I'm going to start with an introduction and the objective of my study. And after I'm going to show you the methods and the results of the study. And of course, I'm going to discuss the principal results, and I'm going to finish with the conclusion. So, the idea of this presentation came to my mind when, first of all, as a med student, I started to think about psychiatry as a field for my career, and I typed psychiatry hospital, and I was surprised about the first pictures that I found. It's all the time dark pictures with empty rooms and people attached, and people are yelling and screaming, and it's stealing really in my memory this kind of pictures. Because yes, mental health still facing stigma, and according to the WHO, mental health disorders are common worldwide, with approximately like 1 in 4 people they are experiencing a mental health. And despite this high prevalence, a significant treatment gap exists, particularly in low and middle income countries such as Tunisia. And the WHO estimates that globally around 75 people with mental health disorders in these countries really are facing problems, and they are not really receiving the treatment that they are needing. And this is due a lot of factors, such as inadequate mental health infrastructure, shortages of trained professional, and exceptionally because of the stigma and the discrimination that they are facing. So, mental health stigma is a worldwide issue, to be honest. It's all over the world. It's affecting millions of people, and it manifests in various forms, such as social exclusion, stereotypes, discrimination, and it has not only an impact on the individuals, but also on their families and the entire society and the community in general. It often prevents individuals from seeking help or disclosing their struggles, because all the time they are really with the stigma. It's really stop them to go and to get treated, or to face their fear, or just to ask for help, because it's not only exacerbates the suffering of those with mental illness, but also perpetuates misconceptions and ignorance about mental health. So that's why we fixed as an objective to evaluate the elements of stigma encompassing attitudes, behaviors, and knowledge directed towards individuals with mental health issues within a youthful Tunisian sample. So for my methods, it's a cross-sectional descriptive study. During 6 months, I recruited 1,000 teenagers aged from 16 to 20 years old. Here is the question why I'm working with the students. Because we know that adolescence is a critical period for mental health development, with many mental health disorders like they are emerging during this time, this critical time. And students are often at the forefront of social change and are influential in shaping attitudes and behaviors within their peer groups and communities. So by engaging the students, we hope to gain valuable insights into the factors that contribute to mental health stigma, and explore also the innovative strategies for combating it within Tunisian society. For the scales that we used the mental health knowledge schedule and the reported and intended behavior scale. These two scales were used to assess the adolescents' understanding of stigma, encompassing attitudes, behavior, and knowledge. And these scales were translated into Arabic, and they were validated in Arabic. So we also, of course, inquired about the personal history of mental illness, or if the participant had a friend or relative with a mental health concern. And of course, we respected the anonyma, and we respected the ethical norms, of course. So for the results, for the social demographic variables, as we said, we had 1,000 participants, 655 boys and 345 girls. The mean age was 17 years old, and the mean max score was 21, and the mean RIP score was 14. And our results show that teenagers with personal history, with personal psychiatry history, believe that people with psychiatric issue could have a full reestablishment. They showed even more acceptance toward neighbors with mental health issues, and even they show that they are more apt to have a relationship with someone with a mental health disorder, which was interesting. And also for teenagers with family history, we found that they were more convinced that pharmacological treatment could be efficient to treat psychiatry disorders, not like others who just believe that the treatment is a way for addiction, or they were just listing the side effects of pharmacological treatment. And also, Tunisians with family history believe that people with mental health issues could get totally reestablished, which was really interesting. We found also that teenagers who had friends with psychiatric history showed like an ability to advise people and to refer them to psychologists or psychiatrists, or even for a person who can give a psychological first aid. And they showed a greater acceptance for being also in a relationship with someone who had psychiatry disorder. So now we are going to try to discuss a little bit, but before discussing, I want just to explain the reasons for this mental health stigma, because we know that the cultural and societal norms and the belief that the mental illness is a sign of weakness or moral failure is playing a big role for these ideas, because mental health issues are often stigmatized due to these misconceptions and superstitions and cultural taboos surrounding mental well-being. Also, we can list the lack of education and awareness in societies, because a limited understanding of mental health disorders perpetuates stigma, and misinformation and myths about mental illness contribute to fear, discrimination, and negative attitude toward individuals with psychiatric condition. Also, the social isolation and discrimination leads also to exacerbate the suffering of individuals, because the fear of judgment and rejection prevents many from seeking help and disclosing their mental health struggles, leading to feelings of isolation and shame, which gonna worsen their state and worsen their condition, and we will enter in this vicious circle. Also, in some countries, low and middle income countries, we still have a structural barrier to care, limited access to mental health services, inadequate funding of mental health programs, and shortages of trained professionals contribute to stigma. And the lack of available resources and support networks further marginalize individuals with mental health disorder. So, our results in our study were like similar to a lot of studies that we found when we did a review of the literature, because a lot of studies showed that having siblings or relatives with mental illness was associated with a decrease in stigma levels and discrimination. And also, a lot of studies showed that having frequent contact with people with mental illness or meeting people who have recovered from mental illness may reduce stigmatization. These people, as the studies showed, they have more skills to deal with the people, and a clearer knowledge about the mental health in general and the conceptions in general. So how can we now give a help for these people? How can we improve and their this conception, and how can we stop stigma? Education and awareness campaigns still really the key for this, because implementing comprehensive educational initiatives to increase public awareness and understanding of mental health issues is crucial. Campaigns should really target schools, as we did in our study, workplaces and communities, to challenge the stereotypes, to dispel myths, and to promote empathy and compassion toward individuals with mental illness. We also try to integrate mental health services by strengthening and integrating them in primary health care that can improve access to care and reduce stigma. We can also like promote for workshops for people in first line, for physicians or doctors giving first line in health system, because it can also help for psychological first aid, and they can help to refer. Community-based programs also can be very interesting for like the peer support groups and the telemedicine platform that can provide access that can provide accessible and culturally sensitive support for individuals seeking mental health, and they can feel understood, and they can find a place how to chat with people that they have the same issue. Advocacy and policy reform still very important in some countries. Advocating for policy reforms to prioritize mental health funding, because according to the WHO, there is no health without mental health. Improve the access to services and informs anti-discrimination laws is very essential, because engaging with the policymakers and healthcare professionals and civil society and all the NGOs and the organizations that can drive to a change and to promote to mental health, and this makes things be easier for the practitioner as we do. And as I talked before, the peer support and the social inclusion still also very important, because fostering a supportive environment where individuals feel safe to openly discuss their mental health experience is really important. The peer support networks, community outreach program, and stigma reduction companies can promote social inclusion and empower individuals to seek help without fear or judgment or discrimination. So, just to conclude, I think our findings indicated elevated levels of stigma among adolescents, and our studies also showed that those with a family history or friends with mental disorder exhibited lower levels of stigma. But we still need to introduce educational sessions on mental health and stigma into schools programs that could serve for potential solution to diminish perceptions of stigma. Thank you very much, and thank you.